Welcome to Basic Medical Sciences. My name is Philemon. In this video, we are going to discuss Krok-1 Microbiology from 2013 to 2017. Right, so on this channel, I have covered a lot of bacteria and viruses, right? So in each and every question, I will be showing you slides like as references, so that if you click the link in the video description, you watch those playlists in great detail, and then you understand, you will be ready for the exam, right? For now, let's stick to Krok-1. Okay. A child with suspected tuberculosis was given Mantoux test. After 24 hours, the site of allergen injection got swollen, hyperemic, and painful. What are the main components that determine such response of the body? Right, so Mantoux test, we know that this one is for TB, right? And you can see the reaction, right? So this is basically an immune, it's a cell mediated immunity, right? Cell mediated immunity. So you can see here the cells which belong to this kind of immunity are polymorphonuclear cells like monocytes, T lymphocytes, right? So you can see here you can see T helper cells, T killer cells. You can see the whole pathway here, right? So the question is saying, what are the main components that determine such a response of the body, right? So the answer is A, mononuclear cells, T lymphocytes, and lymphokines. A 12-year-old boy has been hospitalized for suspected food poisoning. The fecal samples were inoculated on the endo agar, which resulted in growth of a large number of colorless colonies. Right? What microorganism is most likely to be excluded from this list, right? So we are saying like the colonies are colorless, right? So which microbes do you exclude, right? So it's E. coli, because on endo agar it should turn red, right? If it is colorless, then it's not there, then E. coli is not there, right? Okay, so this is an algorithm which I've been using in bacteriology, right? Differentiating this gram-negative bacilli, right? So you can see here, based on lactose fermentation, you see that E. coli, Klebsiella, Enterobacter, all these ones, right? Citrobacter and Serratia, they can ferment lactose, whilst Pseudomonas, Salmonella, Proteus, Shigella, Yersinia, they do not ferment lactose, right? But it's not relevant here, right? So let's just focus on these cultures, right? So here I said the answer is E. coli, though it's indicated on Salmonella. It's just a mistake on the slide, right? So on Mekong agar, fermentation produce an acid causing colonies to turn pink, right? So E. coli on Mekong is pink, right? On eosin methylene blue or EMB agar, the colonies will form what? Green metallic sheen. That's E. coli for you. And one more time again, guys, you need to pay attention. Colorless colonies, they should be red, right? So maybe probably you like on this culture we can find like any of these bacteria, right? But not E. coli, because in E. coli the colonies should be red or pink. A female patient has been diagnosed with cervical erosion which is a precancerous pathology. What defense mechanism can prevent the development of a tumor? Right. Cancer. How do we get rid of cancerous cells? Right. We use natural killer cells. Right. Okay. Here is the mechanism. Right. Right. So this big cell is a precancerous cell or a cancer cell, and this is our natural killer cell. Right. So what it does is that on attachment to this enemy cell, it produces perforins, right, which will make pores on the enemy cell, right? So next, the granzymes, it will release granzymes which enters into the what? Into the enemy cell. That's how it destroys, right? So the natural killer cell releases perforin, which polymerize and form a hole in this enemy cell membrane, right? On this stage, the granzymes from the natural killer cells enter the perforin hole and degrade enemy cell enzymes. And then here you can see the enemy cell dies by apoptosis, right? And then macrophages, this is a macrophage, will come and engulf like these apoptotic bodies, right? Engulfs and digest the dying cell, right? So in cancer, just to remember, natural killer cells. Electrophoretic study of a blood serum sample taken from the patient with pneumonia revealed an increase in one of the protein fractions. Specify this fraction, right? So pneumonia is an inflammation, right? So you need to know the globulins, the kind of globulins which are antibodies, right? So they are gamma globulins. Gamma globulins. Where do they come from? Right. So there is a B lymphocyte or B cell, right? So this cell can be transformed into plasma cell, right? And then the plasma cells can release these immunoglobulins like IgM or IgG, right? So they're also known as antibodies, and they are gamma globulins. A patient with suspected dysentery has been admitted to the infectious disease hospital. Which basic method of laboratory diagnosis must be applied in the first place? Right, so we are suspecting a dysentery, right? Dysentery usually caused by Shigella dysentery, and you should know that this bacteria Shigella is always pathogenic. It's not part of our normal intestinal flora, right? So what do we need to do? We need to isolate this single type of bacteria from a source that contains many, right? So this method is called bacteriological method. Bacteriological examination of purulent discharge from the urethra revealed some gram-negative bean-shaped bacteria located in the leukocytes. They can be identified as the causative agents of the following, right? Gram-negative, right? Urethral, so it's gonorrhea, right? And also you need to know that this bacteria also causes like arthritis, right? And if you take the synovial fluid, you won't find this bacteria inside the synovial fluid, but you find it inside the leukocytes, right? You need to be careful there. All right, so this is gonorrhea. A 50-year-old patient has been administered levomycin for treatment of typhoid fever, but on the next day, right, the bacteria is dying, right? On the next day, the patient's condition worsened. The temperature rose to 39.6 degrees Celsius. The deterioration of the patient's condition can be explained by what, right? So typhoid fever is caused by what? Salmonella typhi, which is a gram-negative bacteria, right? So gram-negative bacteria have endotoxins. So when they die, they release the endotoxin, right? So the endotoxin is responsible for this worsening condition, right? So the effects of endotoxin of the causative agent. A hospitalized patient bitten by a rabid animal has an avulsive wound of shin. What kind of vaccine must be given to prevent rabies? Anti-rabies vaccine, of course, anti-rabies. DTaP is given like in children for prevention of what? Diphtheria, tetanus, and pertussis, right? So pertussis part will be acellular pertussis. Tdap, right? This one is usually given like between 19 to 64 years, right, later in life, and you can see that DAP, like diphtheria and acellular pertussis, will be in lesser quantities compared to tetanus and BCG. BCG is for TB, right? Okay. A child entering the school for the first time was given Mantoux test in order to determine if there was a need for revaccination. The reaction was negative. What is the meaning of this result, right? Okay, so look here, right? After injecting on the, on the arm, you can see here, there will be this pimple, right? This pimple will be measured its diameter, and usually if it is positive, it will be like 15 millimeters in diameter and above. We can say it's positive, right? Sometimes if it is very small, like 4 millimeters usually or less, we can say it's negative, right? What does this mean? It means there is no cell-mediated immunity to tuberculosis, right? There is no cell-mediated immunity to tuberculosis. Negative. So it's straightforward there. 14 days after quinsy, a 15-year-old child presents with morning facial swelling, high blood pressure, mid-slopes urine. Immunohistological study of the renal biopsy sample revealed deposition of immune complexes on the basement membranes of the capillaries and in the glomerular mesangium. What disease developed in this patient? Right, so you need to know this bacteria. Which bacteria causes this condition? Is what is group A Streptococcus, right? So this patient is suffering from acute post-streptococcal glomerulonephritis, right? Okay, let me see. All right, it's fine. I'm going to show you like on this same question, but later I'm going to show you like one of the videos I made in an easy example to remember these conditions, because conditions caused by a group A Streptococcus, they can be divided like into different classes. Firstly, they are pyogenic skin infections. Those include impetigo, cellulitis, etc., right? And then the next group, these are like mediated by toxins, for example, scarlet fever or toxic shock syndrome or necrotizing fasciitis. And the third group, these are immune mediated. Immune mediated, they include what? Rheumatic fever and post-streptococcal glomerulonephritis. Right, so you will see those conditions later in this video. I'm sure there are a lot of questions concerning group A Streptococcus. Right, so let's continue. A diseased child has a high fever, sore throat, swelling of submandibular lymph nodes. Objectively, the pharyngeal mucosa is edematous, moderately hyperemic. The tonsils are enlarged, covered with grayish membrane, tightly adhering to the tissues above. Attempts to remove this membrane produces bleeding defects. What disease are these presentations typical for? Right, so um, where is the buzzword? Right, grayish membrane tightly adhering to the tissue above. This is a pseudomembrane, right? And in that region, there will be like high levels of toxins, and if you remove it, then there will be bleeding, and also there will be intoxication. The toxin will move into the bloodstream, right? So this is actually diphtheria, right? Caused by what? Corynebacterium diphtheria. Okay. So here I just picked a random slide on diagnosis, right? So firstly, gram staining, right? So there will be gram-positive pleomorphic rods, which are sometimes described as looking like Chinese letters. We can also use culture method, right? Firstly, there is potassium tellurate agar, right? On this agar, there will be uh, dark colonies, dark black colonies on lower flux coagulated blood serum medium. After 12 hours of growth, stain with methylene blue, there will be what? There will be uh, reddish granules, also called Babs Ernst granules, right? Okay. A smear of sputum from the patient with suspected lobar pneumonia was stained with use of the following stains and reagents: solution of gentian violet, Logos solution, 96% alcohol, water, magenta. What staining method was applied in this case? Definitely grain staining, right? It's gram staining. A male patient has been diagnosed with acute post-streptococcal glomerulonephritis. It is most likely that the lesion of the basement membrane of the renal corpuscles was caused by the following allergic reaction, right? So it's immune complexes, right? Because the antigen antibody complexes will be deposited on the basement membrane, right? It's a type 3 hypersensitivity reaction, right? So you can see it here. I just picked a random slide from this video, right? So the patient will usually have Coca-Cola colored urine, and this will happen like at least like 2 weeks after strep throat or other superficial skin infections like impetigo. Uh, Patients may also have facial edema, and this disease, this post-streptococcal glomerulonephritis, can develop even after treatment with penicillin, right? Rheumatic fever doesn't happen after treatment with what? With a penicillin. And the other thing to differentiate it from rheumatic fever, rheumatic fever usually happens after strep throat, right? And after skin infections, it doesn't happen. After superficial infections like impetigo, rheumatic fever doesn't happen, right? And I said it's type 3 hypersensitivity reaction, right? So these bacteria, I'm just picking random slides, but in the video description, there is a bacteriology playlist link there. You can click it and watch the videos later after finishing this video. A patient has severe catarrhal symptoms Material growth on boarded Gango agar showed mercury drop-like colonies. Examination of the blood smears revealed some small ovoid, gram-positive bacilli sized 1 to 3 microns. What microorganisms were isolated boarded Gango is very easy. So I said these two guys, boarded and Gango, they were together, right, when they discovered this bag. But you can see the name of the bacteria is called Bordetella pertussis. Only Bordet got the better part, right? So it's Bordetella pertussis. Okay, so this is just an overview from that video, right? So Bordetella pertussis is a gram-negative aerobic coccobacillus. It is a virulence vectors like pertussis toxin, adenylate cyclase toxin, and tracheal toxin. And this bacteria causes whooping cough, and whooping cough has 3 stages. Catarrhal stage, characterized by low-grade fever, coryza, and then the longest period is called a paroxysmal, right, with paroxysms of intense cough followed by inspiratory whoop, right, and post-tussive vomiting. The last stage is convalescent stage, right? There will be gradual recovery of chronic cough, and we can prevent using Tdap and Dtap. A patient has been admitted to infectious disease department for malaise, fever up to 38 degrees Celsius, jaundice. A few months ago, the patient underwent blood transfusion. The doctor suspected viral hepatitis B. What are the principal methods for laboratory diagnosis of hepatitis B? A serological examination. We did it in great detail, this hepatitis B serology. And also gene diagnostics, where we can find the DNA of this bacteria, of this virus. I mean, remember, hepatitis B is a DNA virus. Okay, so I said we use what? Serology and gene diagnostics. A child cut his leg with a piece of glass while playing and was brought to the clinic for the injection of tetanus toxoid. In order to prevent the development of anaphylactic shock, the serum was administered Besredka's method, right? What mechanism underlies this method of desensitization, right? So in this method, you usually will be exposing the patient like to an allergen, to something that he or she is allergic to, in small quantities every time, until the immune system reaction to the allergen is not too much, is not causing what damage to the body. So in this method, is based on binding of IgE fixed to the mast cells, right? Okay, there is another thing that I want to tell you in terms of allergies, right? So IgE, immunoglobulins, and there are some immune cells which start with E. They are called what? Eosinophils. IgE eosinophils. Those are associated with allergies, right? Okay. In the surgical ward, the dressing material was undergoing sterilization in an autoclave. Through an oversight of a nurse, the mode of sterilization was changed and the temperature in the autoclave reached only 100 degrees Celsius instead of 120. Right. What microorganism can stay viable under these conditions? Right. So autoclave is employed if you want to get rid of spores, right? So you just need to think of spore forming bacteria. That's bacillus, like Bacillus anthracis, right? And Clostridia species. They form spores, right? So they will remain viable if we don't reach 120 degrees Celsius under pressure. Right, so the answer is bacilli and Clostridia. Typical manifestations of food poisoning caused by Clostridium botulinum are double vision, that's diplopia, abnormal functioning of swallowing and breathing. These symptoms can develop as a result of what? Right, so you just need to know the mechanism of botulinum toxin, right? So this toxin, when released, it goes to the to the neuromuscular junction, right? It prevents like the release of acetylcholine, therefore causing flaccid paralysis, right? But what exactly prevents the transmission of impulse by blocking the release of acetylcholine is not the bacteria itself, but the neurotoxin, the exotoxin, right? So these symptoms develop as a result of exotoxin effect. Exotoxin effect. A patient consulted a dentist about limited mouth opening, that's trismus. He has a history of a stub wound of the lower extremity. What infection may cause these symptoms, right? If you know, do you know lockjaw? What about Rhesus sardonicus? Okay, let me remind you all of them, right? So these are like caused by tetanus, right? There are conditions caused by tetanus, right? Just one moment. In the previous slide, we were talking about Clostridium botulinum. That its toxin causes flaccid paralysis, right? But tetanus toxin causes spastic paralysis, right? You just need to remember that. Okay. I wanted to tell you a lot about tetanus, but stay tuned. I will tell you later. Just stay tuned. Okay, let's continue. Administration of doxycycline hydrochloride caused an imbalance of symbiotic intestinal microflora. Specify the kind of imbalance caused by the antibiotic therapy. Right, so you just need to know you have a perfect microflora in your GIT, right? So if you take in a lot of antibiotics, you will be killing some of those microflora, right? So is dysbacteriosis, there will be that imbalance, dysbacteriosis. The infectious diseases department of a hospital admitted a patient with nausea, liquid stools with mucus, blood streaks, fevers, and weakness. Dysentery was suspected. Okay, what did I say? What causes dysentery usually? Okay, of course, Shigella dysentery, right? What method of laboratory diagnostics should be applied to confirm this diagnosis? Is bacteriological. What did I say again? I said Shigella is never part of microflora. It's always pathogenic. And there are a lot of bugs, there are a lot of bacteria, right? So you need to select one from many. It's bacteriological method. A 6-year-old child with suspected active tuberculosis process underwent a diagnostic Mantoux test. What immunological preparation was injected? Mantoux test is tuberculin skin test. Stool culture test revealed in a 6-month-old bottle-fed baby the strain of intestinal rod-shaped bacteria of antigen O111. O111 is E. coli. All right. What diagnosis can be made? Coli-enteritis. Coli-enteritis. Right. Is just a strain of E. coli. All right. Here I have an overview of E. coli. Right, everything you need to know. Right, so E. coli is a gram-negative positive rod. The virulence factors include Fimbriae, capsule, and lipopolysaccharide. Right, and the main strains, there is enteroinvasive, also known as what? I don't know how to pronounce this one. EIAC. AEC. Okay, but no, it's easy. Enteroinvasive, then enterotoxigenic. This one is ETEC. Enteropathogenic, right? EPEC, and then enterohemorrhagic, EHEC, right? You just need to remember this one. Firstly, on enteroinvasive, right? It invades the mucosa, right? So it's similar to Shigella, right? It's similar to Shigella. Okay, and then on enterotoxigenic, T, just to remember, for travelers diarrhea, it will be watery. Enteropathogenic, P, for pediatrics, usually children. And then enterohemorrhagic, you just need to remember this strain, O157H7, right, is most common in the US, and it usually causes the sugar toxin will cause hemolytic uremic syndrome, right? And there's a triad for hemolytic uremic syndrome, right? There's anemia, thrombocytopenia, and acute kidney injury, right? So how do you remember this? EHEC, right, is associated with what? EHEC, 3-tech. That's how I remember it. Hemorrhage, hamburgers, right? Eating hamburgers, and hemolytic uremic syndrome, right? So I told you what you have to do. Please check out our playlist. I covered this bacteria in great detail. Bacteriological examination of the urine of the patient with pyelonephritis revealed microorganisms that produce yellow-green pigment, a characteristic odor in meat peptone agar. What are they called? Right, don't be confused. This is Pseudomonas. You know, I know you have read that Pseudomonas aeruginosa produces a blue-green pigment. That's pyocyanin and pyoverdin, right? Here they said yellow-green. Don't be confused. And as characteristic odor, it's a grape-like odor. So from the agar plate, you can actually smell it. Pseudomonas aeruginosa, right? Okay, and again, I have an overview. Aeruginosa is an aerobe, right? It's a motile, catalyst positive, and gram-negative rod. It doesn't ferment lactose. It is oxidase positive and is frequently found in water, right? It's hydrophilic. Then it produces a grape-like odor, I told you, right? Right, that's it. And then what about PEEP? Produces PEEP, right? So this PEEP is like virulence vectors plus the last P is for pigment, right? So which virulence vectors? Phospholipid C, which degenerates or degrades, it degrades cell membranes. There is an endotoxin, right, which is responsible for fever and shock. Then exotoxin A, it inactivates the elongation factor 2. Right, so this inactivation of elongation factor 2 will disrupt the process of protein synthesis, right? And the last P I told you is for pigments, that's pyoverdin and pyocyanin. And also Pseudomonas aeruginosa is also known to produce reactive oxygen species. Right. Okay. During autopsy, the following has been revealed. The meninges of the upper cerebral hemispheres are extremely plethoric, of yellow-green color, and are soaked with purulent effluent. What kind of meningitis is characterized by such clinical presentation? What? Meningococcal meningitis, right? It's caused by what? Neisseria meningitis, right? Neisseria meningitis. Okay, so here I just took this one, right? So this slide is about clinical features, right? So the main features, firstly, it can be asymptomatic, right? So because it's a part of normal flora in the nasopharynx, right? And then the disease is firstly meningitis. Meningitis will be characterized by fever, stiff neck, that's nuchal rigidity, vomiting, lethargy or altered mental status, and petechial rash. Then there is septicemia, right? And then septicemia will be characterized by fever again, petechial rash, hypotension. The most dangerous condition is called fulminant meningococcemia, which is also known as Waterhouse-Friderichsen syndrome, which is characterized by what? By hemorrhage of adrenal glands along with hypotension and petechial rash, right? So please make sure you watch the videos I mentioned, right? They are found in the playlist in the video description, right? So this is the end of part 1. So watch the next video, part 2.